And kia ora koutou, everyone. My name's Catherine Hall. I'm the Chief Executive of Alzheimer's New Zealand, and I was one of the original authors of the action plan and am a member of the Kaitiaki group. So I'm really pleased today to talk to you about our initial thinking about what we should do around the action plan, and to be doing that on behalf of the Kaitiaki group, but in particular alongside my colleague Kathy Cooney from Dementia New Zealand. So I'm just going to share some slides with you. Now, just if someone can let me know to make sure that everyone can see those slides. Yeah, wonderful. All right, I thought it would be useful just to remind ourselves about the plan itself. So when we wrote the plan, we had bold ideas and bold ambition about what was going to happen. So we spent quite a lot of time thinking about the future that we wanted to create with the vision and the goal, and also thinking about what are those 4 overarching objectives that are going to get us to that goal of improved well-being and decreased impact of dementia mate wareware. And we landed on the 4 that you can see on the screen that you will all be very well aware of. And because we were thinking about a 5-year plan, underneath those 4 overarching objectives, there are a lot of actions. So there's more than 20 actions sitting underneath those objectives. And we were expecting, I think, that we would have a relationship with government that would mean we'd be working together actively over that period to make progress on most, if not all, of those actions. But as Teresa said, a lot has happened in the last 5 years, and COVID and the changes in the health system are probably the 2 most significant. That means that we haven't made the progress that we had hoped to make. So with that in mind, the Kaitiaki group has been thinking about, well, what should we do? And as we've been thinking about it, you know, we think it is timely to stop and think about, well, where are we and where do we expect to be, and what should we do next? I think I absolutely agree with Teresa's comment that the action plan is well recognised, it's well socialised, it's accepted, and you could see that coming through most recently very strongly in the submissions to the Health Select Committee, where most of them mentioned the action plan in one way or another. And I think that we all know that the the size and scale of the challenge, the number of people who are struggling because they are living with or being diagnosed now with dementia mate wareware and not able to get the help and support that they need, that is just growing. But we also know more now than we did 5 years ago about the things that we know will work to address that challenge. So the argument in favour of having a plan remains really strong. So that's where we landed. We think it continues to be important that there is a sector plan that provides a blueprint for government action to do more and better for people living with dementia now, and to reduce the impact of dementia in the future. So what do we think should happen? Well, we've been thinking about this for a little while, and we do have some recommendations to make to the network. So our view is that the bones of the plan are good and continue to be relevant, but there are some things that need to be refreshed and updated. And so what we are recommending is a refresh, not a full rewrite. So we're not suggesting going back to a blank sheet of paper and starting again. We're saying let's refresh and update the plan for 2025 and for the next 5 years. We also think that having more than 20 actions sitting under those overarching objectives has probably made it harder to get a focus on getting started on this work, because it all does seem a bit big and a bit hard. And so our recommendation to you is that for the next 5 years, we focus on the most critical things. And for us, we think that they should be the priorities that the network identified last year. And again, Teresa mentioned those, but so they are the 4 that are on the screen. So I think we all know that timely and accurate diagnosis is very hard to get, and it's a really critical point in the process and in the journey for many people. And we need to do better in that space. And aligned to that is the need for comprehensive management planning. And that all needs to happen in primary care. The second thing is about driving more equitable provision and funding of community-based services across the board, because most people live at home, as we all know, and desperately need better access to services where they live. The third one is about the support for the workforce, who are such a critical part of the sector, but also for care partners who are playing such an important role in supporting people with a diagnosis of dementia. And the last part of this is the brain health program, because as well as supporting people living with dementia today, we continue to think that it's important to look at reducing the impact of dementia in the future. The other 2 things that we're recommending to you is we do think that equitable access across our population is really important. And we think that people should have access to equitable access to services regardless of their cultural identity, regardless of where they live in Aotearoa, and regardless of how old they are. It should be fair and equitable. And the last thing that we're recommending is that there be no change to the vision or goal or overarching objective. So we're really focusing on saying a refresh, which is about updating the context and also focusing on narrowing the priorities down to a small number of manageable priorities that we can all focus on together over the next 5 years. Now, we have also been thinking about some other things, and so I just wanted to share those with you as well, because you may well have some thoughts on those as well. You know, we haven't got as far as we had hoped to when we wrote this plan back in 2019, 2020. But there has been some things that have happened, and the governance ecosystem, so the Dementia Wareware Leadership and Advisory Group and the network, and also the 7 pilots are part of that. And we do think it's important that we don't lose ground as we move forward. The second thing is that we are very aware that the dementia sector sits within the wider aged care sector, and that we all need the whole sector to work effectively together. So we can't just focus on the dementia sector, we need the whole part of the sector to work. And we also need the parts of the sector that interact with and support disability services and other parts of the health sector to work well too. And the last thing we've been thinking about that we'd be interested in your feedback on is around the need for a small number of key indicators, because it's very easy for us all to be very busy doing things, but we think it's really important that we have a small number of key indicators that apply to the whole sector that we can use to track whether we're making the progress that we want to and whether those changes are heading in the direction that we expect them to. So we think it's important that there is work done in that space. So finally, I just wanted to say that when we wrote the plan, we worked really hard to engage with the dementia sector, and the plan that currently exists was informed and contributed to by feedback from over 300 organisations and individuals. And that was a really important part of the process. It made it a better plan. It really strengthened the plan. And we want to do the same thing this time. And so we're starting that process with this discussion with you today. We're really keen to hear your feedback. We'll also be going out more widely through our own networks, because we really want this to continue to be a plan that's been shaped by the sector and is supported by the sector. So with that, I will stop sharing my screen, and just before I hand over to Matthew, who is going to guide us through the discussion, just ask my colleague Kathy if she has anything to add.
Kia ora koutou. Thank you, Catherine. So I just taupoko everything you've said. And I think we can't underestimate how critical the action plan is as a cornerstone for the work that we're all engaged with. So just we really welcome everybody's input today so that we can keep to strengthen and ensure that the action plan continues to be relevant and focused. Thank you, Catherine.